welcome to the Heme Consults podcast. This is orientation video number 20. I'm talking about special populations. I'm talking about consulting teams, surgeons. When I was in med school, I was on the surgery service and I was wearing heels this day. And I was walking with a surgery intern who was walking super fast. And he kept turning to me and telling me, you got to keep up, you got to keep up. And he was moving so quickly. And to be honest, I acknowledged my limitation. I was wearing heels. I wasn't going to be able to move so fast. And I said, hey, why don't I just keep walking the way I am and I'll catch up with you in a little bit? And it was just important for me to say, hey, I have a limitation in this way. And I know it's important to you to walk fast, and I'm not going to be able to do that right now. I share that story to say that in our interactions with surgeons, it's important to know that many times they're goal focused and very goal oriented, and they have a plan. When they call you, they have a plan. And it's important to recognize that you're the consultant for a reason, and to own your power and to own your space. So I am dedicating some time today to talk to you about what to think about when you are interacting with surgeons who are calling consults. The first thing I want you to think about is that they are primarily proceduralists. They're not internal medicine docs. And it's important to recognize that because they're focused on doing surgeries and handling the complications of surgeries or evaluating patients who might need acute or urgent or emergent surgery. And so they're really focused around getting patients to the procedure, from the procedure, and out of the procedure safely. And so when they're calling, they're pretty focused around making sure the patient's optimized for surgery or is ready to go home. And you want to think about their priorities relative to perhaps a medicine team's priorities when the surgeon is calling a consult. Okay, you got to remember that surgeons are not medicine docs. And so sometimes you may be asking about how is the hypertension, how might it be playing a role in the DIC? And to be honest, surgeons are very, very capable people, and they don't think about internal medicine issues all the time. So when you're asking questions, ask questions carefully, recognizing that they may not have the detailed level of information that you're used to having from your medicine colleagues, and that's okay. You're going to figure the rest out, but you do want to make sure to push to get the information that you need. Okay. Now, it's important to recognize these hierarchical structures in surgery are ever present. Now, in general, hierarchical structures are present in medicine as well. I do feel like they may be present to a greater extent in surgery, and it matters who calls you about the consult. For example, if, say, a physician extender on the team calls you about the consult because the senior surgeon asked them to call, they may not feel empowered to ask. You'll see this with interns as well, where the intern is asked to call the consult and they may not have a clue why the consult is needed. And so when they call, they're like, we want you to see this patient. And they can't give you any information because they don't even understand themselves. So I need you to recognize that there is that element of hierarchy that may prevent people from making their lack of knowledge known for fear of judgment. And sometimes when you get to the place where you're trying to elicit information about your patient, recognize sometimes that maybe there is an information gap and be compassionate and don't push too hard. Okay. The other thing I want you to recognize, so number 4, is behind the bluster, there may be fear. So sometimes people are like, I want you to see the patient now, and I don't care what you're saying. We're giving Novo 7. Sometimes they're doing that. Sometimes your blood is boiling, your temperature is rising, but you want to recognize that sometimes it's fear. It's that my attending said we needed to get this drug, and if you say no to me, I'm more afraid of my attending than I am of you. And so some of that bluster may be fear. You want to recognize that. And although it doesn't feel good, you just don't want to fight fire with fire. You don't want to be like, well, if you're mad, I'm going to escalate too. It's not very productive for you or for them. So what you want to do to the best of your ability is to bring everything back down again and say, I see that you're really anxious about this, and I want to be able to understand so I can make the best recommendation for the patient. And that might help them come down, or it might not, but it's worth the try. Okay. Even when there is yelling, maintain your composure. This is really important. There's so many people who are angry, upset for different reasons in medicine. The problem is you're on the phone a lot. And so a lot of this energy is coming at you. It's easy to lose your cool. Nobody wins when you lose your cool. And you have to think about it. It's like somehow it's unfair. It's like they get to yell at me and I don't get to yell back. Yes, because you're the one who's there to kind of cool tempers and cool emotions so that we can think critically about the patient and get them the best care they need. So Always be ready for the conversation you have that may throw you for a loop, and have a plan. Okay, if a person starts speaking to me in a way that I don't like, I'm going to pause, take a deep breath, and say, when you are talking in a raised voice, it makes me feel disrespected. And it's helpful because sometimes the person doesn't change what they're doing, but you acknowledging and naming the feeling that you're experiencing is helpful for you. So whatever you need to do to regain your, to maintain and or regain your composure, please do it so that you can provide the best care possible. The other thing I want you to think about is that you're the expert. They called you for a reason. Your recommendation is important. Sometimes there may just be the sense that you're just calling me because you want bivalirudin and you don't care what I have to say. That may be true. They're very, very focused. Perhaps an attending has given them a mandate that they feel like they have to carry out, but it's still important that you recognize and own your leadership as someone who has the needed expertise, or will get the needed expertise, or has access to the needed expertise. And so even when teams are insisting on their own way, take the time to think about it and feel certain that you are making a recommendation that's in the best interest of the patient. Don't just cave in and say, well, I just don't want to feel uncomfortable anymore. You can have what you want. You do want to be thoughtful, because at the end, you're going to generate a note in the chart that outlines your thought process. So your priority, and this is number 7, is to understand the problem. Help them help you understand the problem. They should know about their patients. At least they should know enough about the consult question that they're calling. So you want to hold them accountable so that they can give you that information as well. So in your next interaction with a consulting team from surgery, have a plan in advance. You're about to talk to a surgeon. Perhaps the call came from the OR. Have a plan in advance. How will I respond if they do something that triggers my anger? Imagine if you had a plan like that and at least considered it before every phone conversation. There would be a lot of different conversations. All right, I'll see you in the next video.